There's a lot of trials that are beginning to answer clinically relevant questions in lung cancer with liquid biopsies. I think we've already learned that there's good concordance between liquid and tissue from the same patient. A positive test in a plasma sample essentially rules in the genetic alteration. So we don't need any more trials looking at concordance. What we need are trials looking at the longitudinal assessment and changes in the ctDNA over time on a therapy, and to see if those changes are reflective of outcomes. So there's a lot of trials looking at this, looking at what we call molecular response. A patient on a targeted therapy who's getting, receiving the targeted therapy and then monitoring their blood over time to see the changes in the particular mutation, and seeing if this is indicative in more real time of how the patient is doing or how the tumor is responding. And so I think we're doing a lot of trials in that space. I think the other area where there are ongoing trials is looking at it again in the post-curative intent setting, looking at monitoring ctDNA after a cured attempt, and then monitoring for minimal residual disease, and then acting on that minimal residual disease if need be. I think those are really the trials that need to be developed that will answer these important questions clinically.